Hi, I'm Satin Wilson Chai, and I'm a biomedical engineering student at Georgia Tech, and I want to talk to you about neoplastic meningitis, also called leptomeningeal carcinomatosis. Neoplastic meningitis is similar to meningitis in that the area that the disease affects is the meninges, which is the membrane that surrounds the central nervous system. The meninges involve three components. It's the pia mater, the dura mater, and the arachnoid. And neoplastic meningitis affect mostly the subarachnoid space, which involves the arachnoid and the pia mater. Neoplastic meningitis is a form of cancer. It's a secondary cancer, so it's not like lung cancer or breast cancer, which is a primary cancer. A secondary cancer is caused by primary cancer having progressed enough to metastasize and develops an enzyme that can break down blood vessels. So these cancer cells enter the blood vessels and travels to the brain, where again it breaks down the blood-brain barrier and is able to go through and enter the cerebral spinal fluid. Once cancer is inside the cerebral spinal fluid, it uses that to travel inside the brain tracts and there spreads to the spinal cord and the rest of the brain. Victims of neoplastic meningitis experiences many symptoms, some of which are headache, mental status change, confusion, cognitive impairment, and also damage to the spinal cord. There's really only one good way to diagnose neoplastic meningitis, and that is through the study of the cerebral spinal fluid to look for any abnormalities or to look for cancer markers. To gain access to the cerebral spinal fluid, the suspect would have to go through a lumbar puncture. Normally, 2 samples of cerebral spinal fluid is drawn to ensure that the diagnosis is accurate. The only sure way to know that a suspect has neoplastic meningitis is if there's actually cancer cells inside the cerebral spinal fluid. An MRI may also be used to help diagnose. However, this means that the tumor would already have to develop inside the meninges. Once a patient has been diagnosed with neoplastic meningitis, he or she will only survive about 4 to 6 weeks on average if there is no treatment. However, if there's treatment, the patient may live up to 4 to 6 months. And the reason that these patients have such a short amount of time left is because that there is really no standard treatment for neoplastic meningitis. And usually, the fact that neoplastic meningitis is a secondary cancer means that they've already suffered much damage from the primary cancer that they had. Treatments for patients with neoplastic meningitis is palliative, meaning that they only try to maintain the quality of life of the patient. The most common form of treatment is chemotherapy, specifically intrathecal chemotherapy, and that's when the chemicals insert through the spinal cord to gain direct access to the cerebral spinal fluid, mainly to avoid the blood-brain barrier. Since most of these drugs are not small enough, the 2 most commonly used drugs are Depocyte and MTX. Radiotherapy and surgery can also be used, but that's mostly only for developed tumors inside the meninges. Treatments for neuroplastic meningitis is harmful for the body and the brain, and that is one of the main reasons why neoplastic meningitis is very dangerous and difficult to handle. And if you guys would like more information on neoplastic meningitis, please visit Wikipedia. I've started a page on neoplastic meningitis, and there's a lot more detailed information there, including how it affects the spinal cord. So anyway, I would like to thank you for your time.